You had mentioned earlier that you obviously had some prolotherapy because you have joint hypermobility. And a lot of the folks actually that we see with C1, C2 instability are young people. I mean, we've seen plenty of teenagers with C1, C2. So how would a young person know that they have, say, joint laxity or joint hypermobility or Ehlers-Danlos?
Okay, so usually, I mean, I didn't really actually ever knew I had it until I became a prolotherapist, and then it kind of clicked. But you're really kind of limber. Like, you're more flexible than, let's say, the average person or your friend. That you can even kind of look at your elbows, if they hyperextend, as opposed to, instead of just getting them like this, they actually go farther. Your knees, if you can take your thumb, I'm not going to do it, but, get it to touch to your forearm or bend your fingers back to 90 degrees. It's kind of like a little screening tool that you could do yourself, or, a provider could do it to test for hypermobility. I had joints that kind of click or crack a lot. That's kind of another sign, too, especially if it happens all over your body on a constant basis. Not so much for Ehlers-Danlos, but for just hypermobility.
Yeah, and there's some specific criterion for Ehlers-Danlos, so we have a lot of young people that come in for that. And we often get into discussions with them as to why some person with Ehlers-Danlos could not get diagnosed till they're in their 50s, and other people get diagnosed when they're 10. And I think the main reason is, and by definition when we say Ehlers-Danlos, it's just somebody who has a congenital hypermobility condition in that their collagen is already stretched out and ligaments are made up of collagen. So there's specific criterion, like you said, you can touch your thumb to your, there's the Beighton scale, which they call it. So we go through that with them and we make the diagnosis of Ehlers-Danlos syndrome. But why some folks don't get diagnosed with Ehlers-Danlos or other folks have problems early on relates to how active they are. In other words, there could be a child who didn't get involved in sports, has Ehlers-Danlos, might even have, very severe joint hypermobility, but they didn't get involved in gymnastics. So the body doesn't need so much joint stability to walk. But if somebody was to play soccer, even a lot of the young people are playing soccer, I mean, the joints have to be a lot more stable, the ligaments have to be tighter, when you're playing soccer than if you're just walking. So I think that's why we're starting to see more and more Ehlers-Danlos syndrome cases or congenital joint hypermobility cases in young people because they're just very active, like girls and guys, at a very early age are getting involved. Now, some folks will ask us at what age can somebody start getting prolotherapy? Is there really an age limit?
As I talked to you earlier, I've treated people as young as 8 years old. I don't like to. I mean, I'll try conservative things first. Yeah. I mean, and something, usually they don't even need much treatment at all. Most of them do really, really well very quickly. You try to do many times I will just try some gentle physical therapy, maybe rest them if possible, maybe some gentle exercise, things like that. But if that doesn't work, we will do it. And most of them have really tried that, and they come to us, and by that stage, and then they're ready for it. And you know something? Most of those young kids that I've seen, they do fabulous. They're great patients, and they get better really fast.
Because they're growing so much tissue. I mean,
right.
If someone's in the growing phase of life, say up until age 16,
right.
I mean, a lot of times it's just 1 or 2 visits.
Absolutely.
Because they're all you got to do is start the healing process.
Right.
And then the youngest that I've treated is the age of 4. So we had a Down syndrome kid, Down syndrome child that was, their knees were dislocating. So I mean, it is awful. The parents got to hold them down, and everybody doesn't like treating a 4-year-old, but one visit, fine. So I mean, in the end, it's better for the child, to get it resolved.